Okay, is it visible, audible, screen, all
Yes,
okay
sir.
now?
Yes, sir. Yes, sir.
Okay.
Yes, sir.
Sorry for the problem, but as I said, technology can be very deceiving sometimes. Okay, thank you so much for bearing through this time. And today's session is about how to better your patient conversion rate in your practice. So we're meeting after almost slightly less than 1.5 months. So all my presentations always will begin with thanking the Lord Almighty, who's given me much more than what I deserve. So this is my brief biodata. You all are aware of it. So today's topic, mini paid group webinar number 4, how to better the patient conversion rates in your practice. So we all know that today's times, especially in healthcare industry, they are very, very competitive. We have options for all the procedures. We have options for all the, say, patients have options for all the professionals as well as, and there is mind blowing competition. We really need to understand it, and it is not always say a limited one. It is a hyperbolized or exaggerated one as well. And courtesy, there is a hidden competition from Dr. Google as well, so which actually makes life of many of us practitioners a lot difficult, because many times things which are given on Google are not always correct. We all know that, but then it has the potential to create indirect competition between us and the patient. So again, conversions of practice or conversions of patients to practice. Remember, we all do consultations in our practice, not the ones that we do as a visiting professional, but the ones who visit us for a consultation are actually converted as our permanent clients. Again, has been historically, 20 years back it was little easier, 10 years back a little less easier, but 5 years back comparatively difficult, and in today's times even more difficult, especially in COVID times as well, when there is a cutthroat competition, and when there are talks of economy, say, reviving, bouncing again, going down. There are so many parameters involved in that. Again, it used to be like that. The patient called us for an appointment, or maybe just walked in. 20 years back, there was no concept of appointment at that time. So if he was happy with your way of talking, if you and more or less, it was not a time that patients really valued the communication part at that time. Coming from me, as I said, I have been into 22nd year of practice right now. Many of you, Dr. Rakesh, who or many other colleagues who are into the same time parameter will agree with me. Patients came by referral sometimes. Word of mouth was the biggest external marketing, and they hardly actually debated. They either got the treatment done or not. They never went into too much details. A little easier time for doctors at that time. Doctors were still considered equivalent to God. In tier 2, tier 3 cities, there was no concept of consumer courts. There was no concept of negligence. The only thing, गलती हो गई तो भगवान से भी गलती हो सकती है, तो डॉक्टर से भी गलती हो सकती है. It was like that kind of scenario. But then times changed. They changed more 10 years back, even more 5 years back. But in the past 2, 3 years, when the competition about, say, churning out colleagues has been massive, the total game has changed in dentistry. And the problem is that in the patient conversion race, the race should have been for the better patient experience, but instead it became the race for the price. And the problem is that we actually got into the wrong train. We were traveling from Kashmir to Chennai, and we boarded the train to Kolkata, the only, or to Ahmedabad. We never forgot that from north to south there might be east or a west as well. There are a few ladies out here. I'll ask them, if it was always about price, would any one of you buy 5-day-old fruits just because they may be at a one-fifth price? The answer would be strictly no, because we all believe that healthcare is the prime thing, and sharir theek hai to sab kuch theek hai. People as always give the example, and if price was the criteria, Tata Nano should have been the most successful car. Tata uses Jaguar parts in its cars. People just had this illusion that if it was selling for 1 lakh, 1 lakh 25 odd grand, or 1 lakh rupees, would they be still using the Jaguar parts? But again, we all know that even sometimes in this cutthroat era, we quote the lowest price, still the patient doesn't get converted. Have you wondered why? No, we don't. We don't think via patient's mind, because we sometimes make them believe that yes, price might be the criteria. People believe that this is an inflationary time, and maybe in today's times everything is expensive. Why is he charging less? So if I have to summarize patient conversion, for majority, of course, we talk about the majority, there might be some exceptions, there might be a few percentages, but if I have to summarize in one line, the whole thing boils down to patient experience, and it all starts from consultation. We discussed about the first consultation in the last webinar in February, so you all know what exactly is first consultation now. So this is a prelude and say for prologue to that presentation, if I can say that ways. So think via patients. We decrease the prices to lure more patients, and we all know my own written quote for this: insecurity stems from the infertile mind. Why? Because the only problem in our head or mind is that next buck will come from where, and we actually quote the old rates. I happened to visit a colleague of mine, and trust me, he was charging 3-year-old rates even today. I didn't say anything, but since I keep going to his clinic, so I know what he usually charges for a few procedures, and he was charging exactly. So once the patient left, I asked him categorically, "Are you really sure what you are charging? I know you are maintaining good COVID protocols, at least decent enough for the patients to be visible. But still, are you burning a hole in your pocket, or what are you doing in that sense?" So, is this the only factor that pricing has to deliver with that? I will say no. Now, if we talk about the patient conversion part, uh, assumptions and arrogance are the basic reason people actually commit mistakes. I, all of you know that I travel all over India, of course, not in the COVID times, for my lectures and workshops. And sometimes I come across colleagues who boast of this thing. I have a OPD of 50, I have OPD of 45. Fair enough. Do you treat all the patients? Yes, all my patients get converted. I don't know what exactly do you call a conversion. My conversion parameters are very different. I can consider those patients as a conversion whose budget may be starting from 10,000. If I have to talk in a broad sense, if I have to talk in a microscopic or a say mini view, I will say all of those who came into my door, they all get converted, or whatever percentage they get converted. If the patient just had a procedure, came in, just walked in, wanted a simple single class 1 restoration, he got it done, or he didn't get it done, I will not count that as a conversion or a non-conversion, since he came from somewhere and he went into nowhere. I have in my city, there are many engineers working, building bridges. They are transferred from some places. They are here for a project for 2 to 3 months. Do I count them as my patients in that sense? No. So I'm not talking about those colleagues, but I'm just talking about myself in this case. So we need to understand that the whole conversion part is centered around the budget as well. You don't count the scaling or the filling or the other conversions. Yes, colleagues may disagree with me slightly on this point, that maybe if he gets a small procedure done, he'll get converted for the bigger procedure. But again, I'm talking of the holistic picture, not as a microscopic view. So people believe that whatever that comes through the door, they 100% gets converted. I actually don't believe that, because conversion has a lot of parameters going in. External marketing, maybe word of mouth as well, arousing the interest and the awareness factor. And again, your internal marketing, when it takes over, coupled with your staff's role in that, and your counseling, your consultation, your delivery of the patient. Again, the patient consultation which we talked about comes into this. We need to understand those parameters as well. It is a combination of many factors which plays a role in your OPD, in your conversion, and in your say clinic flying high. It is not only a one parameter. People actually confuse and want a magical formula that can give them success sure shot in the night, overnight. It does not. So this is a slide which I have been talking verbally since almost say 5 years now, but never made this slide. I was surprised. I searched through all my slides. I never had this slide. So this obviously I speak this line multiple times. So what is an ideal patient conversion rate? Have you ever calculated that? I always say it is 7.2 or 72 out of 100. That is a perfectly ideal ratio. Of course, you might be doing better than that. Again, my parameter out of this is the big ticket purchase or the big ticket case. The minimum acceptable bare minimum is 4 out of 10 or 40 out of 100. An average or a healthy one is 5.5 or 55 to 60. So this is the conversion rates scenario or a figure for Indian situations. If we talk about the Western countries, the American countries, the European countries, their conversion rate is 10%, 9 to 10%. But then their way is whosoever say calls them through advertising or maybe through email marketing, they consider that as a client. And out of that, whatever the number of leads they generate, their conversion is 9.5 to 10% or 9 or 10 out of 100. So their parameters are different. In Indian situations, we live in a different scenario. External marketing is not in that sense properly allowed to us. Yes, there are certain taboos in that, certain riders in that. So our calculation part is very different. So I talk in a different sense here, not in the terms of the Western countries. So again, what is the first step in that? Again, I will go back to the basics. The first thing is where you are and where you want to go. My favorite line. So what your current conversion rate is. So then set realistic expectations. If your current one is 30 out of 100, you can't immediately jump to 70 or 80 out of 100. That is actually phenomenal if you can do that, but which is actually not possible. But then you have to slowly climb the ladder. You need to understand what are the factors which are holding you back. What are the reasons? Then unless you understand your situation, unless you say implement those strategies, then only you can go on improving. Again, the sky is the limit. Go on setting higher benchmarks for whatever you want to as you go on improving. But this is optimization is a process which is never done. We get settled or we get happy at a say a certain percentage, and then we say okay, अब जितना आ रहा है बहुत है, इससे ज्यादा मैं संभाल नहीं पाऊंगा, तो मेरे को grow नहीं करना. See, growing or thanking God in one is a different aspect, but then say optimizing or improving continually is a different thing. You should always challenge your assumptions and keep pushing. Trust me, majority of the dentists do not know their conversion rate. If I go to the previous slide, they do not know their conversion rate because majority of the dentists do not do record keeping. And unless they do record keeping, how can be they aware of their numbers? It is only a very few percentage of dentists who are doing it. And again, if they are analyzing, they'll be doing it. Again, out of that very small percentage are actually analyzing it. So the basics will always be the key. Do the record keeping, go through that, what actually went through that. Of course, I'll be dealing with those things in the coming slides. So we all know, as I said, the bottom line is a better patient experience. So three aspects are very critical in that. Of course, this presentation is about the tips, but the tips will surely come at the end. But before that, a few aspects. So number one aspect is improving your scheduling. One aspect which I have been always said delving or very great importance on is scheduling part. Always schedule according to Pareto principle. When you are the freshest at your freshest situation, always schedule the patient according to that. Always work according to the revenue part. Then the consultation appointment. This is again, these are not in any order. Of course, sometimes an initial consultation can be before, the scheduling can be afterwards. So don't take one and two in that particular order. The consultation we dealt in detail, in depth in the previous webinar, in the first consultation. So again, that presentation, I was surprised that I've never taken in a webinar form, but then it was there. So, and again, the post procedure follow up. So these parameters are very important. And follow up has three criterias, three important steps. I'll be dealing that in the tips part if you stay till the end. So a few critical points in this. We always say a staff member is always the backbone. We all have issues with the staff. We have some, very few of us are lucky who have say, uh, long attaining staff members who have been with them for a long period. Even I had a long then, but then we all have issues. Staff leaves in between. Staff have their own problems, their family problems. The COVID situation created unexpected problems for many of us, even me as well. But then we should not be in a hurry to just hire a staff member, because remember, staff is the mirror of the clinic. You are not there in your clinic all the time. The staff is still there in the clinic all the time. Whatever the staff conveys to the patient in your absence, your reputation and repertoire will build up according to that. So you need to understand this aspect very, very clearly. So when you have a skillful one, and you know that yes, this is the guy, or this is my man or woman Friday, as we call them, or your right or left hand. So don't immediately put the whole workload on them. Firstly, go easy on them, let them get settled into the clinic, and then once they are good enough to handle it, then only put them into tough situations, even if it may take time. Do not be in a hurry to do all these three steps, because these three again play a big role in patient experience and in turn patient conversion. It is always better that you deal with the patient directly than the staff, if your staff is newly hired and not very well trained, rather than actually staff को patient के सामने डांटने की बजाय, if especially if it is a new one, go easy on him, attend the patient yourself. So this is again a three pointer, because staff attitude is a big key in these aspects. Now the receptionist point. Again, I have not been personally a big fan of receptionist, but yes, this is a existing scenario for many bigger clinics. You actually need to understand that people will have their own unique situations, and what works in my situation might not work in yours. So somebody having a different sort of a clinic parameters may be not working with different aspects. So receptionist role, wherever it is there, wherever the receptionist is existing, it is a very difficult role. You have to understand, as we call them in psychologically point of view, she or he needs to have a split personality. Have you ever noticed, if the receptionist is a she, which majority is, she does not move from the seat. She is there attending calls, doing everything. But if the receptionist is a he by chance, he is always two timing. He is working inside the staff, inside the clinic as well, and is manning the reception as well. So here the females will feel lucky that in that regards. But yes, men receptionists are very unlucky in that regard. So as I said, they need to have a split personality. They are the chowkidar, and on one way, chalo bahar chalo, chalo bahar chalo. And on the way, welcome, sir, good morning, sir, good evening, sir. Whatever way you can say, they need to say change their split. They need to change their face, expression, attitude, behavior with the say flip of a hat. So they need to understand the communication part is very, very essential for receptionist, if it is there. Again, these points which I'm mentioning are say portion of better patient experience. Yes, tips will come separately as well, but don't discount these points. These are also a part of tips as well. So then the quality of communication, we discussed this in the first consultation. Again, there is a direct ratio between the length of time you spend with the new patient and the percentage that converts. You should have a knack to judge which is a big ticket purchase and which is not. And once you start judging that quickly, you need to spend a lot of time. Remember, this time will always be paying you back. And the conversion percentage will drastically go higher. No, I told you my parameters of calculating the percentage. Now, let me know, just telling you a fact. If two patients with a simple restoration drop out while you're consulting, while your big ticket purchase gets converted, effectively out of those three, you will say my conversion is 33%, but the revenue or the volume wise, it is a huge number. So think about those parts. Again, a few more perfect strategies. Always, when you consult, keep it simple yet glorified. We have to be authoritative and continue to educate patients. Because remember, you have not always to be Mr. Blah, blah, blah. You just don't keep on speaking. But then at the same time, when you are inviting patient questions or the patient is asking you for the doubts, do not, do not always entertain the patient treatment plans, even if they are not acceptable to you, if they're not acceptable to you, especially because the patients might be googlified, they might be having their opinion in that regard, and they will actually say ये कर सकते हैं, चलो ये भी कर सकते हैं. The moment you say this, the patient will start judging you that he doesn't give me this option, I am giving him this option. So where does he stand for in that part? Then you have to, when you are using the patient consultation words, choose them carefully. Do not use complicated or scientific jargon. Always maintain a college level of comprehension to keep your patients engaged and motivated. Again, do not simplify your content too much so that you it feels that you are wasting the time, and or maybe you actually fail to build your trust as an expert in their eyes. You need to understand that part as well. Then create marketing funnels. Funneling is basically engaging the patient and being prepared for everything. So, what actually your patients needs the info about, and you have to surpass those funnels. And it is actually that they develop this trait of asking the questions, and you market to them internally whatever they need to what they will need to ask. Basically, apprehending what will be their next question. So, this is a marketing funnel. Awareness, interest, consideration, intent, evaluation, and ultimately purchase. Of course, this is not exactly a purchase, but this is what an exact marketing funnel looks like. And similarly, a sales funnel will look like this: awareness, consideration, purchase, retention, advocacy. Attract, convert, engage, sell, connect. So these parameters are actually very important. And those who actually have high conversion rates, they focus on building strong patient relationship, because it is these connections only with the practice that actually motivate them to move forward in the conversion process. So let me discuss a few tips with you, precisely 15, to help you achieve better conversion rates apart from a few points that I mentioned before. So tip number one, again, these are a combination of the consultation, scheduling, and the better patient experience. So tip one would always be effective listening. Always have a space between your two ears. Be very patient. Have a good listening atmosphere, good listening attitude, because that'll only uncover the patient needs and wants. I always say patients will say many things, and just say assume the reverse scenario. Most of the patients will have this complaint: डॉक्टर ने हमारी बात ठीक से सुनी ही नहीं. Of course, I'll be dealing with these in the summary part as well in the end. But which are the commonest problems which patient encounter, that the patient, that the dentist or the doctor did not listen to their problem? He was too busy either fiddling with the phone or attending the call, or say, talking to his assistant, or just having improper body language. He actually didn't listen to me. He actually didn't pay proper attention to it. Then a sales approach, as we say, people who say, I don't have a good patient compliance, my patients are not very happy with me, try having a sales approach. जैसे कस्टमर को भगवान मानो, सेल्स अप्रोच ऑलवेज से कस्टमर को भगवान मानो और पेशेंट को भगवान मानो, एंड गिविंग इंपॉर्टेंट वैल्यू. So you need to understand those things as well. Then tip number 3, we always create a sense of apathy, but we need to create a sense of urgency as well. I always say whatever the patient has walked in for, whatever the patient's chief complaint is, we need to understand that, treat it with the 3 E's, as I always says: efficaciously, effectively, and efficiently. We treat that, and then before the patient leaves, we have to indulge in the alternate I&E, information and education, so that the patient knows what other problems are existing, irrespective of whether the patient asks or not. If the patient asks, you are on the right track. But if the patient does not ask, it is your duty. But then you have to create the need. And I always say you can create the need mathematically as well. If it is a pit and fisher caries, you know that the pit or the pit and fisher triangle might be a deeper one. Explain the patient the consequences of root canal, of a deep restoration turning into a root canal or maybe a crown as well. Explain it mathematically. Let's suppose you might be charging 800 to 1000 for the restoration, but a root canal, core, and maybe a crown, not always, but maybe a crown, the cost might go up to 8 to 10,000 rupees. So explain that mathematically, that the cost might go up to say 8 to 10 times. So if you create a sense of urgency as well, this is nothing but smartly creating the need. Again, you're not doing it, but don't be unethical about it. Don't spread false information. Always give opinions which can be verified and which make a difference. Then if you force patients to accept a treatment plan before they are ready, they'll be less likely to trust your advice. You are indulging in I&E, alternate I&E, information and education. Don't try to push it. ये ठीक है, ये आपके करने वाले आपको अगली अपॉइंटमेंट दे दूं मैं. Don't try to. Just create an urgency, but let the patient think over it, sleep over it, and let them call them yourself. Maybe they have understood the sense of urgency in behind your message, but maybe they are not actually happy with your services, so they might not be taking the appointment. But if they are happy, always use a pull strategy. Don't push it. Let the patient be pulled back to you with your happily created patient experience in patient's mind. And that is, I always say, knowing it is about knowing the patient's needs and the wants. Sometimes the patients might say have come in for a problem in a molar, but they say off the record maybe mentioned, doctor मुझे करवाना तो ये front वाला भी है. Maybe they'll let you know in that regard. So again, these are the different, as I said, the post-procedural follow-up, it comes in 3 forms. People can take it in different manner, but one of them is the feedback way. We should always take a feedback. It has a great value. Ask for it. You won't be belittled. If the patient has a point to make, value it, and if you can, implement it. So this is a procedural feedback, or say of the total treatment done as well. There is a separate one which is a follow-up care part. Again, I'll be coming to that as well. So then positivity. If you are positive, you actually will be conveying a good sense of security to your patient, and it reflects your behavior, your strength as well, and your confidence in your own abilities. I always deter the negative side. It is very dark and dingy. I have been in those areas many a times. I understand those, how demoralizing those phases are. So if you are very, say, sure of your skills and your treatment plan, convey it strongly. But again, don't cross the line. Don't be too overconfident. Listen to the patient, understand the problem. Don't be in a rush. Don't be in a hurry. Judge it. Judge it very, very realistically. And if you need some time, sleep over it. Then advise certain things to the patient before say jumping onto the treatment bandwagon or advising things and changing your treatment plan the next day. Think before you speak, as they say. Then sincerity. This is one thing I always believe, that if you create a hue and cry that the patient does not come on time, look at the mirror. How many of you are sincere in reaching the clinic on time yourself? And I told you, this is one aspect which actually will make you go down many ways. If you are not on time just because you didn't have an appointment early in the morning, your clinic starts at 9, you had your first appointment at 10. So you're walking in your clinic at 10:05, 10:10, the patient is already there. What were you doing for those 65, 70 minutes? You need to answer yourself. Maybe somebody walked in, maybe your staff didn't attend to him properly. You need to make sure that you are there in your clinic times, irrespective of the appointment. And sincerity is actually a reflection of our upbringings, how much, say, committed we are to our profession, or how much we value others' time. Again, do we stick to our tongue? I gave my example many times. 22 years of my practice in my residence, I've never been late even by 10 minutes in these past 22 years, not even 10 times. My clinic starts on time. I am there on time, usually 5 minutes before that. So not to boast of that, but the only thing is there are certain things which are or should be a part of your system. If you expect your patients to be punctual and sincere, you have to start by with yourself and lead by example. Then respect the patient's time. Treat them on time. If you can't wait yourself, please don't make them wait as well. And doesn't apply to your VIP, but your normal patients as well. I've given you example many a times. The patients say this thing. Uh, at least two patients say in 1 week this thing. We come to you for record keeping just because you have all our record keeping. We come to you from so far because you don't make us wait. Waiting time, if I say anything, waiting time is a big factor in internal marketing. People laugh at me, but yes, waiting time is a big factor. Nobody wants to waste time unless he is having a lot of it. Then resolve the patient complaints or misunderstandings in a jiffy. Always treat your suffering patients on priority, out of 10 maybe, because I believe in that spiritual aspect as well. There is a more curse in a suffering patient rather than a blessing by a healthy patient. So दुआ से ज्यादा बद्दुआ में ताकत होती है is a say loose translation of that. So I always try to say resolve the complaints of such patients in a hurry, in a jiffy crisis. So again, remain approachable. Call back your patient if any call is missed. The normal attitude is, we are doctors, why should we be calling back? Yes, many clinics have changed that mindset now, and because this is an era of competition and everybody has choices. But also, we need to understand that there is no harm in calling back. The call rates are, anyways, the cheapest in India at the moment. Then always evaluate a conversion or a non conversion. Right from the initial phone call to the last follow up, everything needs to be evaluated, especially for big ticket cases, of course. How the step went, which were the errors, make notes of that. If any procedure or if any sitting you had any goof up by the staff, by your side, of course, if it was covered properly, then fine. But make sure that it is in your special comments and you actually make sure not to repeat them. Because ultimately, we have to develop systems and processes which are patient centric. And that is the need of the hour today. So, for making appointments, follow the 3 C's. And this is a consistent process. I always say scheduling is very important, and it is actually a way of reassuring the patient as well that they have chosen the right clinic or the right practice. So the 3 C's are capture, credential, and close to earn their appointment. What exactly it is? The first step is to capture information about the patient by asking a series of questions. Luckily for us, COVID changed many things. And we are dealing with the first C very effectively. We are capturing the information before the patient visit, or maybe during the patient visit once the patient is in. Then credential the clinic, dentist, and procedure so that patient knows the clinic's value proposition. That what do you stand for? What is the clinic's mission statement? What are the clinic values? What are the principles that you follow? Then close the appointment by gathering all appropriate patient demographic information, the patient's source of referral, the patient's socioeconomic background, any previous experiences, or whatever, or the patient's distance from the clinic, or the patient's margin needed for any appointment or cancellation. All those things you need to understand and make a mental note of it, or at least your man Friday or your staff or your best staff should make a note of it. So these are very small little things which actually go a big way in patient conversion. We tend to think in other ways that मैंने तो अच्छी तरह से बात की थी पेशेंट से पता नहीं माना क्यों नहीं देन अनदर सॉर्ट ऑफ डेंटिस्ट वुड से मैंने तो पेशेंट को इतना कम रेट दिया था फिर भी नहीं पेशेंट माने so these are not things which are going to matter ultimately. It is always the complete patient experience which is going to matter. Then explain fees and payment options before the start. We always try to be very friendly with the patient sometimes initially. कोई बात नहीं आप बैठो कर लेंगे कोई दिक्कत नहीं. Why do we need to make a shortcut? Why a shortcut on fees and payment? Why a shortcut on consent part? Why a shortcut on the record keeping? We need to understand that every patient, howsoever rich or middle class or poor, will have a budget, will have their own, say, limitations. So we should have a fee code prepared for the patient, and a breakdown should be provided if the patient asks for it. So some patients may be too embarrassed to ask about all the payment options, whatever you are available, Google Pay, Phone Pay, credit card machine, net banking, NEFT, or check, or whatever modes you are offering. So make the patients feel financially comfortable so that they can actually realistically feel that they can afford the procedures. Of course, financing is not that important part in our side of the world, and of course it is a big factor in the western world where financing by the financial institutions is very common. But yes, barring one or two limited options from a few finance companies, we don't have much options in that. So again, if you convey everything before, explain fee and payment before, you will have a lot less payment woes at the end, again related to the patient consultation part only. But then this is a procedure, or say we have to follow this yardstick for every patient, I believe. Then again, another part, a feedback is a different thing, a follow up is a different thing in that regard. So I always say follow up with the patients passionately, like you do your procedures. If you love your profession, if you love dentistry, obviously you will be working passionately, you'll be working with determined attention. But a follow up is a very important thing and important aspect in creating your value. And even if it is a small procedure, just ask the patient, because the patient should be mentally secure that yes, I am being taken care of postoperatively as well. You are there for him at any point of the time if it is needed. And patients do value these small little things. This is nothing but just showing your care part. Then the last thing, track the progress or the conversion rate. So dig deeper into the record keeping every fortnight, if you can, every week, if possible, because sometimes a month would be too long to do so. And set a percentage goal, measure it regularly. Because as I say, measure आप तब करोगे ना जब आपको पता होगा आप कहाँ पे हो. So know where you are and where you want to go. So create on increasing your benchmark or your yardstick of where you go. So record keeping के लिए I always have a quote: history always digs out trails. So the more you dig out your record keeping, the more it will tell you actually what your conversion rates have been. So I've given you a huge list of 15 plus 3, 4, 5 before that. So what are the main ideas? If you're confused, let me give you a summary. So many a times we believe that past success, पहले ये success इस चीज से मिला है. The dynamics of the game have changed in today's times, more so in COVID times, even more so in the second wave of COVID in the country right now. So whatever gave you success will may not necessarily give you success in today's times. So the future needs to go beyond this. So assumption of what creates success in dentistry conversion rates need to change. As I said, assumptions and those arrogance factors need to go. And we need to let go of that, because our profession, medical or dental, we actually maltreat our customers or the patients, if I may say so. Many of us, if not all of us. How? It comes in many forms. If the patients asks certain things, we can't we do this thing? Let me decide. I am the dentist. I am the boss. Or maybe some are not. Some are not even settled. Patient making the patient wait long time, jumping the queue, treating a VIP patient first, than your normal patient. And actually, consumers will assume your technical competence कि डॉक्टर है, काम तो आता ही होगा, पास हुए हैं तो काम आता ही होगा. Remember when you are going on the, say, jetway to board a flight, do you ask the pilot, तुमने पहले कितने क्रैश किए हैं, या तुमने पहले कितनी फ्लाइट्स अच्छी उड़ाई हैं? I travel a lot again before COVID times, so usually I sleep in the flight, and whenever the flight lands, the landing decides the credibility of the pilot for me. So whenever I have a jerk like this, it's a idiot, tougher kahin ka. And whenever the landing is smooth and it didn't even feel, and I just say come to my senses after from being woken from my slumber, and when I know that the jet has landed also and has slowed down also in the runway, so yeah, perfect landing, yeah, juk juk geo pilot. And these are the things which spontaneously come out from your mind. So these are the technical competent factors which we actually assume for a doctor or a dentist as well. So we need to understand that technical competence is one thing, the patient experience is another thing. Because now come to the reverse scenario. What will the patient assume? And again, those are the soft skills which are transcending the boundaries of clinical capabilities or technical competence. Was I listened to? डॉक्टर ने मेरी बात ठीक से सुनी ही नहीं. Was I given every opportunity to ask questions? Remember, you are not in court, but these are the things, again, as I said in the pricing slides, think via patient's mind. Was I given? मेरे सारे सवालों के जवाब दिए गए? Were those questions answered diligently, honestly, or as per my satisfaction, or were just tried to be covering up? Does this feel like a safe place, especially post COVID times? Is the doctor maintaining precautions? Is this the dentist I can trust? If you are in the reverse scenario, won't you be actually, God forbid, you encounter a medical situation in your family for any family member, and if you have to consult a specialist for a procedure for any of your family member, even for yourself, wouldn't you be asking these questions? So why don't you keep yourself in your patient's shoes and try to imagine or say, uh, uh, suppose these situations? So do not underestimate a patient's ability to focus on these issues I mentioned. So yes and a no will not make a difference. And sometimes mediocre soft skills will produce a mediocre response. Doctor, I'll think about this and take my family's opinion before I come for the treatment. So if you are dealing it in a mediocre way, do not expect a superlative response. What you do, you will get that only. Remember that. So you have to treat your each patient honestly. We all say that we our clinic stands for being patient centric. Our approaches are actually the reverse of that. We actually see the convenience of our consultant and staff, maybe the everywhere present waiting room, or the ubiquitous waiting room, or the non-adherence to timings by ourselves, even if the patient is late. So, and if the patient is late, we create a hue and cry. If the lab work is delayed, we don't inform the patient, causing the patient an agonizing wait. Then staff issues, the chair is not ready for the next patient, the staff having a bit of problems. We have to consider these things as well. If you are in a reverse situation, what will you do? What is all this doing? Creating a bad patient experience. So remember, this is all works in a cycle and it all comes back. These actually cues convey that you are more important than the person you are serving to the patient, and the patient will interpret all these things differently, and we need to understand that they will actually refuse to follow. Today's patient will not follow the old script कि नहीं dentist तो भगवान है या doctor तो भगवान है. Those scripts are changed now. You have to write new scripts. Make sure that your practice or your clinic stands for what you do and what you say in deed as well as in word. And remember, does it enhance the patient experience? Because that experience will lead to a conversion. So change whatever does not fit into that. Any refinement, small or big, will be worthwhile. Maybe not immediately, but in the longer run. So sometimes the patients won't see an instant yes, but maybe couple of days, 1 day, 2 days down the line, they will. So we have to understand that every patient is a VIP for us. It is not always the budget of the patient that matters. For calculation part aside, but for treatment part, SAB or VASAB, as I always say, SAB and VASAB treatment, every patient should be a VIP. So I hope you are not bored enough. So coming to the last couple of slides, the carry home Gyan. So these tips are actually designed to improve your patient consultation process as well. If I can say, this is an extension of the patient consultation webinar that I took. So that is available now on YouTube. You can watch that and again increase the surgical conversion rate or the dental conversion rate or the cosmetic conversion rate, whatever it is in your practice. And if adopted well, the overall quality communication can be elevated. So dentists and staff can have more opportunities to build rapport and have good connections. So the patient practice connection will always matter. And when patients feel that they are have an experienced, trusted liaison between the dentist and the staff, they gain the confidence to move ahead gleefully, cheerfully, and smilingly. So we all work towards patient satisfaction, and patients want to know what more you can offer, more than that, more than the technical aspect. What is the service parameter? What is the whole scenario? What they can offer? They also need to know why it matters to them and why they should choose you as their dentist. A good consultation is a series of steps to move the prospect initially making into a permanent client. And it is not the say conversion that is important, it is the retention that is important as well for any practice. So be a go-getter to change your life. It is time to step up and just do that. Focus on where you want to go, not what you fear. So for that, you need to know where you are and where you want to go. So Benjamin Franklin may have discovered electricity, but it was the man who invented the meter who made it a real fortune. If you make the efforts in the right direction, you can go higher. So thank you so much for your patience. So this is my contact details, since these videos go later on YouTube as well. So I have to add these slides. All of you are aware of it. You know about the YouTube channel. Now the videos are being posted regularly every alternate day. So if you have not still subscribed to the channel, please hit the bell icon, subscribe. You'll get a lot of videos. So Idea Times Part 51 has been published in March 21. So 4 years and 3 months now. So all of them are available as well on my website. So my social media presence by my name only, Dr. Bhavdeep. So do send me your feedback in the WhatsApp group. Bouquets and brickbats both would be welcome in equal measure. So thank you so much, and I stop my presentation for the question time. There, and yes, you can unmute yourself and ask the question. Any questions?
Hi, good evening, sir. Sir, I have a question. Can I ask?
Sure, sure.
Sir, let's say that a patient gets delayed. the patient's appointment get delayed by 15 minutes, 20 minutes because of a difficult extraction, then how should we convey to the patient? Because sometimes patient gets finicky, the patient who's waiting in the waiting area.
See, for this, I've given an example of the European professors funda, ASAP, Market Assumptions funda. You always acknowledge the patient immediately on arrival. Let the patient know
Yes,
yourself or through your staff member that we are
correct, correct.
expecting, we are having an unexpected delay in the procedures. And if
Mhm.
you are in a hurry, uh, you can reschedule your appointment, or if you would not mind, please wait on for some time. In the meantime, you can offer some tea or coffee, whatever, if it is an option with your clinic. So do offer that, and I'm sure most of the time most of the patients would understand. So this is the reason I always advise extractions to be kept either at the end of the morning schedule or in the beginning of the evening schedule, so that there is a less overlap of the patients in that regard, and even the sterilization protocol is not broken to a greater extent.
Okay, sir. Thank you. Thank you.
Yes, anyone wants to add anything on that, or instead of us, there are no. All good or no good? Dr. Murugan is not here. He wanted to ask certain things. Yes, Dr. Anu. Okay, then if it is all, if you have no questions, we call it a day. We'll meet tomorrow, 8 p.m. Hopefully, there will be no technical issues. Till the delay was not much, 20 minutes or so because of that. Okay, please do post your feedback in the WhatsApp group. Thank you, Dr. Anupama ma'am. Unable to unsure myself, unmute yourself. Let me do it for you. Just click on I've yes.
Hello, can you
Yes.
hear me, sir?
Yeah, sure.
Yeah. You mentioned that we tell the total cost to the patient, and if the patient asks the breakdown, then you mention it. For example, like if the patient has to undergo root canal, post and core, and crown lengthening, and 3-unit bridge, and all that. So, do we tell them the total cost, or we start explaining them these are the charges, and this would be the total cost?
The only thing is that you should be explaining the cost, but if the patient asks, you should be ready with the breakdown as well. It is
Oh,
not
so
that you have
we
to
have to
necessarily
explain.
provide with the breakdown, but you should be ready with the total quote. But if the patient asks that what is exactly the breakdown of this, how did you arrive at this calculation? So you should be giving out that as well. What I meant to
Oh,
say was this.
okay.
Yeah.
Okay, so we have to explain them these are the procedures required, and then the total cost is this much.
Yes, of course, you have to explain them because ultimately the consent form has to be signed.
Okay,
Once
okay,
you
okay,
verbally explain it, then only you can go about it. It is ultimately an informed consent. You have to verbally explain first, then you explain the consent part. You have to tell in that sitting as well about the consent signing part as well.
okay, okay, sir. Thank you.
Sir, can I please add to that,
Sure, sure, sure.
to the respected colleague? Sir, I'm going to please inform you that thanks to your guidance, I have bought a diary. And in the diary, what I do is every time I have a consultation, if it is two treatments or more than that, I write the patient name in the diary on a new page. And now I write the chief complaint and what are the multiple treatment options. Being a prosthodontist, I give minimum 3-4 treatment options to every patient and they get confused. So everything, what has to be done to which tooth, What is the cost? What are the treatment options? Like there is an implant option, there is a bridge option, there is a removable option. Everything is written in front of the patient. Sometimes I draw diagrams in the same book to explain it to them what it is. All the charges are mentioned over here. It is all written, and then it is shown to the patient even at a later date for our references when we want to check whether this was discussed, not discussed, what was discussed, because I am the one who's doing all these things, and sometimes the charges are taken by my wife. So this books comes as very handy. Books comes very handy. I'll just show you one. Sir, if you see this, so this patient, Mrs. Aisha Begum, there's so many missing teeth. What is the roots, terms, and crowns, and everything? Then three options given. In these three options, again, now, if you see this, I have actually removable, semi-fixed. All these things are completely discussed and running into 4 or 5 pages. Sorry. So running into 4 or 5 pages. So that's how I have started doing it. So I have some record. I'm not giving anything in writing to the patient, so patient cannot go and challenge me anywhere. And we have had a complete discussion. Everything is in written format. Patient finds it very easy.
So, Dr. Anu, there is also a part in that, because unless I verbally convey it, my consent form also mentions the complete charges. And
Yeah.
before you go to the charges part, you need to remember this part as well, that you need to be sure of your treatment plan. You gave a treatment plan. Let's suppose that probably this is a root canal, a normal core, and a crown. The patient later needs a post and core. The patient later opts for a zirconia crown. What will your documentation cover initially? Let's suppose a root canal core and a crown costing 8,000 rupees or a 10,000 rupees with the normal PFM crown. But now the patient has opted for this zirconia crown. He said, "चल थोड़ा बहुत difference होगा, ज़्यादा difference थोड़ा होगा." Again, colleagues who are charging less, their desire, but my basic PFM and my basic zirconia charges are 3 times difference minimum. So the only thing is that the patient needs to understand that the extra payment cost is to be by that patient. So always make it on the higher side, plus minus 10% should be added as a buffer as well, so that even if those things are not needed, that will be covered in the minus 10, and if not, in the plus 10, so that you are on the safer side and there are no payment issues at the end. And always keep on charging on the higher side, as I've detailed you in the record keeping session as well. Always keep on charging at the various steps. You have to convey, once a consent form is signed, you have to convey the patient's treatment methodology, how you're going to go about this procedure. Again, you have to be mentally sure of yourself that nahi pehle ye procedure karna hai, then this, then this, then this. Keeping in mind your peak time of appointment, keeping in mind the patient convenience, and keeping in mind the break period to be given if an extraction is there in between, so that the patient has an ample rest as well. Keep in mind the patient's working schedule as well. Keep into mind, don't do late extractions as well. So all those things have to be taken care of while manipulating a, say, while making a treatment plan. Probably I'm used to these things since many years now. I don't need to think about it. Certain things are automated in my system. But then many times when you make a treatment plan, take care of all these factors apart from the money factor as well. Because again, ultimate bottom line aim is to create a patient experience. The patient will say, सारा कुछ ठीक था, मेरे पास भी था डेंटिस्ट, पैसे भी ठीक लेता था, काम भी ठीक था, पर मेरे को वेट बहुत करवाता था। बाकी सारा कुछ ठीक था, उसका स्टाफ ढंग से नहीं बात करता था। सारा कुछ ठीक था, लेकिन कोने में उसके डस्ट पड़ी होती थी क्लिनिक के, सफाई नहीं करते थे अच्छे से। सारा कुछ ठीक था, टॉयलेट बहुत गंदे थे उनके। Just a few examples. So yes, we cannot be perfect every time. I don't want everything to be flashy as well, but at least it should be decent, comfortable. That is what the aim should be. Because ultimately, the patient experience. Whenever you see anyone complaining about you, just step into their shoes and then decide whether the criticism is justified. If yes, the criticism is justified, then take action, implement it. As they say, Australian language, take it on your chin and implement the change. Because ultimately, it will come back to you only. The patient will feel happy that the opinion has been valued for and has been respected for as well. I
Yes,
hope I
sir.
make it clear.
Yes, sir. Yes, sir.
Sure.
Thank you, sir. Thank you, Rajat sir.
So any more queries?
Hello, sir.
Yes, Dr. Madhav.
Hello. Yes, sir. So actually, to start with the FMR case, so I'm a bit confused, like how to convey the charges for the FMR, like all the like preclinical charges or something like diagnostic mounting or something. How to convey phase 4 transport and everything like extra charges, apart from crown and bridges.
You have to convey the patients that these are the part of the procedure, and without resorting to these procedures, you cannot give the final result to the patient. Of course, everything comes at a cost. And if the patient has, trust me, if the patient has chosen you for the FMR, the patient has come from a good reference. And if the patient is discussing that, and if it as a later stage of discussion with you, he or she will not budge down, surely. Those who have to buzz down, they buzz down at the initial stage only. So convey it confidently. Always keep a higher margin. For normal cases, I say plus minus 10%. For FMR, keep a margin of plus 20%. Because sometimes there are some costs which are, say, not visible initially, but they are, say, applicable on us, and we feel happy. चल कोई बात नहीं, एक FMR तो किया, कोई बात नहीं, कम profit में सही, अगले में कमा लेंगे. That one FMR case, if it is successful, yes, it should be, but if it is successful, it will give you many referrals, and that referral charging will become the benchmark or the yardstick कि मेरा तो इतने में कर दिया था, तेरा क्यों नहीं इतने में किया, तेरे भी इतने दांत, मेरे भी इतने दांत. So those sort of things, that female gossip, as we call it, sorry for that, but that female gossip thing goes round in circles, and it actually will create a problem for you in the second FMR case that you're going to. So convey your charges confidently. Trust me, जो 1 लाख खर्च सकता है वो 1.5 लाख भी खर्च सकता है. जो 1 लाख नहीं खर्च सकता वो 20,000 भी नहीं खर्चेगा. So that is the thing you have to remember. Patients are
Okay, sir.
very learned these days. They know what an FMR costs. I'm just giving an example of 1 lakh, not exactly in those senses. Don't take the money literally. But
Okay,
what
sir.
I mean to say is, if the patient is for a big ticket, he knows that what he's up to and what he'll be charged. So convey it confidently and always keep a higher margin in such cases, because there might be some hidden costs as well, which even you might not be knowing.
Okay, sir.
Yeah.
Thank you, sir.
Sir, can I just share my protocol, please?
Sure, sure.
So, Dr. Madhvi, what I do is after the first
Yes, sir.
consultation, I inform the patient that if in case scaling is required, then we start from scaling itself. That first you have to get the scaling done. And I explain that I need
Okay,
to
sir.
see for a FMR, obviously there
Yeah.
is a lot of tooth loss, tooth structure loss. So I have to
Yes,
inform
sir.
the patient this, and I have to inform the patient that I need to see where exactly is the healthy gingiva, unattached gingiva, and I need to calculate where the tooth is. So if there is calculus stains, I cannot see that. So we start with scaling. That is the first thing. In your mind, you need to be very clear while you are proposing the treatment. Like I just showed you the book. So in that book, I will write exactly how sir said, step by step. If I am going to do any root canal, that I have to mention that this is the root canal, these are the teeth that I will be doing root canal, these are the charges, this is the total. Then if there is any
Okay.
question mark, a doubt, this tooth may require a root canal, that will be a separate heading with a question mark that this
Okay.
may be an extra charge added to this treatment.
Okay.
I'm not sure. It can be a restoration, it can be a
Okay.
root canal. Then regarding crowns, I always write the cheapest crowns and I write the most expensive crowns that I have. So they have a range that they have to pay me minimum this much, maximum this much. And I always tell them that I have 18 options for crowns. So you can choose anything you want. Charges will be decided dependent upon what you choose. I have given you a range of minimum and the maximum. Now, after the entire discussion, I test waters. How do I test water? I want to see whether the patient is only doing a window shopping or actually getting the treatment done by me, and if my charges are acceptable. So I always tell them that first thing before I do an FMR is 99% of the cases of FMR, in my limited experience and knowledge, the lateral pterygoid is always tender. So I have to first of all attack the lateral pterygoid. I need to have a proper occlusion, the centric. For that, the muscles of mastication have to be completely unsore, relaxed. So I tell them that I will
Relax.
charge you 15,000 rupees and I will make this stabilization splint, Michigan splint. And this is the process. This is how I will make it. You have to wear it for the next week to 15 days. Now, there are two things that I get to know from this. First, affordability. Second, can they and will they follow my instructions? If they don't follow my instructions, that again will come and bite me at a later date. And whenever I do an FMR, I always, 98% cases, I give them a stabilization splint at the end. So what I do is I charge for that initially because everything is going to remain the same. I just have to
Yeah.
make a new stabilization splint. Everything is ready now towards the end. By making one stabilization splint initially, I get to know about their mindset, their pocket, their economics, and how convincing I have been.
Okay. Hello.
Yes, Dr. Madhav.
Yes, sir.
Clear to you?
Rajat, Rajat sir, what were
Yes,
you
yes, yes,
telling
sir.
about?
Yeah. Yes, sir. Yeah. Thank you, sir. Thank you, Rajat, sir.
Rajat sir, you were mentioning about some tests. Could you please repeat it?
Test?
That was testing the waters, he said.
Testing.
Just
Yeah,
test whether
what is that? I
it will
didn't
pay or not.
understand that.
Okay, please repeat, Rajat.
No, no. See, I was just saying testing the waters as in I want to understand the entire situation.
Oh, okay,
It's
okay.
just a phrase.
Okay,
It's just a
okay.
phrase.
Yes, yes, yeah. Okay, sir, got it. Thank you. Thank you.
Okay, guys, it's almost 9:30. We will meet tomorrow 8 for a session. Thank you so much. Do post your feedback in the group. Thank you. Take care. Good night.
Thank you, sir. Good night. Take care, sir.
Good night, sir.
Thank you, sir.
Okay.